Thank you, Dr. Neha. Thank you, Hindi team. Now we are moving to our English session. Today is our 1561st day of continuous webinar. Thank you all the participants for joining with us. We have 3 sessions in Hindi, English, and Malayalam. So continuously, we are conducting this webinar with the intention of uniting the homeopathic doctors and homeopathic lovers together in one platform to share the knowledge and for the development of homeopathy. Thank you all the participants and faculties. We will have a silent prayer before beginning the session. Thank you and welcome once again all the participants. Today is our 1561 day of continuous webinar. Today's our guest is Dr. Samir Chaukkar. He's MD. He has been working in Badras Academy for the last 10 years. And he has vast academic and practical experience with various colleges and universities in India and abroad. He has conducting many seminars on homeopathy in Australia, New Zealand, Canada, USA, Malaysia, Belgium, London, Turkey, and other countries. And then he has done postgraduate diploma in addiction treatment from Canada and done PG and HMD from London. And now today he's going to take about batch flower remedy. He has already taken about batch flower remedies. Today, batch flower remedies in skin disease. You are welcome, Dr. Samir Chaukkar.
Hello. Am I audible?
Yes, sir. Yes, you are audible.
Okay. So thank you, Dr. Ajini, for a nice introduction as usual. So good evening, everybody. I think we had one session of batch flowers last time, and during that I told you about my experiences, and I told you about how batch flowers are so very important in our practice, and how along with homeopathy also we can use batch flowers. So today basically I wanted to talk something different from what the normal understanding of batch flower is, and it is my own experience that I want to share with you. Normally all of us who are homeopaths and who are doctors, we always think of and we are taught that batch flowers are only for emotional disorders or emotional symptoms, and we don't give batch flowers for any physical problems, right? But then what I have done or what I have learned in my practice is that yes, batch flowers are meant for emotional problems. They are meant for feelings only. But if a person comes to us with a physical problem, be it a skin problem, be it cold, cough, coryza, fever, whatever the problem may be, we are not going to indicate the batch flower remedies on the physical problem. But just like homeopath, we are going to see the mental picture of the person also. What is the state of that person? When the person comes to us with fever, whether fear is the most important thing. Normally in homeopathy, we will think of aconite for fear, right? Or stramonium for fear. Why not think of a batch flower remedy? So combining the physical problem, though physical problem we will not consider at all. In homeopathy, we consider both the physical problem as well as the mental problem to give a homeopathic remedy. But in batch flowers, we will not consider the physical problem. Yes, we'll consider, but what we are going to consider is इस फिजिकल प्रॉब्लम के साथ उनकी क्या इमोशन है, ये बहुत जरूरी है. Okay, so therefore when you find out the emotional state during a physical ailment, actually you can treat any physical ailment also with batch flowers. So when we say that batch flower is only for mental problems or for mental emotions or feelings, yes, we are right. But that doesn't mean that we cannot treat physical problems with batch flowers. I treat nearly every day at least 10 patients or 15 patients with batch flowers who have got physical problems. Remember that. That doesn't mean that I'm giving on diagnosis. I'm not, somebody comes to me with motion sickness, I don't give him scleranthus just like that. But what is the feeling of scleranthus is sometimes here, sometimes there. I give scleranthus even in panic disorders. I give scleranthus even in bipolar disorders, when sometimes the mood is good, sometimes the mood is bad. Sometimes they are very cheerful, sometimes they are very angry. So Kabhi ha, kabhi na, something like that. That's where scleranthus. We know scleranthus always goes from one choice to another. So you can apply batch flower remedies to all physical ailments. And that's what I've been doing now. I want to share my experiences. If you also start doing something like that in your practice, I'm sure we'll go away from the normal delusion we are in that batch flowers ke liye only mental symptoms are required. No, somebody coming to us with physical problems, we can treat him. We cannot tell them, no, 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 we are batch flower practitioners and you have to give me some mental symptoms, then only I will give you batch flower. No. When you come to me with vertigo, when you come to me with fever, what are your exact feelings? What has led to this problem? So ailments from again is very, very important. What has led to this problem? What is actually your main concern? How are you feeling now? Do you have any fear? Do you have any anger? Do you have any resentment? Do you have any jealousy? And fever can be taken care of. Cough can be taken care of. Headache can be taken care of. Migraine can be taken care of. Any and every physical problem can be taken care of if you know the feelings of the patient. Remember that. Okay? So I'll just share my presentation with you. Okay. Can you see the presentation? Dr. Ajini,
Yes,
can you see
sir.
the?
Yes, yes, it's visible.
Okay.
Dr. Edward Batch.
Okay. So last time we talked that Dr. Edward Batch was a conventionally medical doctor. He was a proper MD. Then he did homeopathy, and he was sent during the First World War. Remember, and during the First World War, he noticed that soldiers with similar injury, because everybody's gunshot wound, everybody's leg is cut off, everybody's hand is cut off. When they came, they always recovered in the same way. He wondered why. On further observation, he realized that the two other factors which determined the cure or determine the recovery of the person was his personality and emotional state. Remember, long time back, because he was ultimately a homeopath, he was a follower of Dr. Hahnemann. So he saw that when two people came with gunshot wound, one person who was depressed, sad, and feeling that he's going to die would really not recover. While the other person who was optimistic and he wanted to go and fight again for his nation, he started healing very fast, though the treatment given to them were the same, whatever antibiotics or whatever painkillers were given. Even the person who was quite optimistic required less morphine as a painkiller than the other person. Because in war, what is given? So much pain is there, you give morphine, opium to people, right? Even that does not help with the pain. So these were the two factors that he found out. Then those who were with optimistic personalities and positive emotional state were more likely to recover well. In 1920s and 1930s, emotions were dismissed by medical professionals, and today also. I mean, when a person comes to you with cold or coryza, if it is an allopathic doctor, he is not interested whether he is sad or whether he is happy, whether he has somebody is dead in his house, whether his animal died, whether his father went abroad or whatever. They are not concerned. They say you have got cold, okay, we are going to give you some antibiotic, we might give you some antacid, we might give you some steroid. These are the 4 or 5 tablets that every GP will be giving, right? They are not concerned about the mental emotion, but we as homeopaths are concerned. So at the beginning of 1930, just like Hahnemann, Dr. Batch became disillusioned with conventional medicine. He left London and his popular Harley Street practice in search of plants, which eventually became the 38 Batch flower remedies that we know today. Dr. Batch found through careful study and research that a disharmony within oneself was the root cause of the disease, and therefore remedies from the system are always selected on natural character, temperament, and state of mind. Every remedy is associated with basic human emotion. So I'm not going to read everything because last time we had done all this. Now let's go to the most important thing. As you know, whenever somebody has any skin problem, let us think about what happens. Okay, I develop an acne. I am a young girl or I am a young boy of 15, 16 years old. Suddenly, when I get up in the morning, I see a big acne coming up, a red spot on my cheek. What is the feeling of that young child? What is the feeling of that young teenager who wants to go to the college? This is the time when they really want to show off, they want to be very good, they want to impress other girls or impress other boys. At that time, some pimples come here and there. First is shock, remember that. You must have seen many advertisements in TV for acne and pimples. When the girl looks at herself in the mirror, she becomes like this, shocked, right? So there is a shock and non-acceptance. अरे मुझे कैसे acne हो गया? My diet is okay. I am eating fruits. I am not eating oily. I am not eating pizza. My periods are okay. Still, why I'm getting acne? So there is a shock. So this is the first feeling. For that sake, anybody who's got a psoriatic patch or who's got a vitiligo patch will get the first feeling is shock and non-acceptance. That how can I get this? Right? So shock and non-acceptance is the first feeling. Second is how can I get it? Maybe there is something wrong in me. मेरे खून में कुछ खराबी है. Is there something bad in my blood? Should I do a blood test? Poor self-image, low self-esteem. These are the common things that we start feeling. We start blaming ourselves that maybe I had something yesterday, maybe I had some oily, maybe I had too much non-veg, maybe I'm not passing enough motions, maybe I'm constipated. Therefore, so self-blame and guilt is another thing. Second is anger, resentment, bitterness, even towards the colleagues, towards the friends, that why she doesn't have it. Remember, there was an advertisement long time back. भला उसकी कमीज मेरे कमीज से सफेद कैसे? There are two people walking across each other, and one has a white shirt, one has a cream shirt, and the other guy looks at him with jealousy and envy. That how is his shirt whiter than mine? Remember that? So there's a lot of anger, resentment, bitterness. At the same time, jealousy. And ultimately, you try many things. You try antibiotics, you try Ayurvedic, you try homeopathy, Unani, nothing happens. Then you go into kind of a sadness, depression, and hopelessness. You start daydreaming that one day I'll become Amitabh Bachchan. One day I'll get a role in the movies. One day I'm going to become like this. So thinking of the future at the same time brooding on the past. That what skin I used to have. Like girls, usually when they come for hair fall, or a woman of 30, 35 coming to you with PCOS or hair fall, she'll say, I had such long hair, doctor. You can't believe my hair has become now so small. My hair was so long. This is past disagreeable events. These are not disagreeable, past memories that I had good hair. Past, my skin was so glowing, doctor. You don't know. There were so many guys who used to fall for me. And now nobody even looks at me. And I've got these stains here and there. See how bad, ugly I'm looking. What the patient speaks is very, very important. And how the patient, last time also we said, it's not only what the patient speaks, but how the patient speaks. Look at doctor, look at me, look at the pimples, look at how I'm looking now, look at how ugly I am, how beautiful I was. When I look into the mirror now, I hate myself. Nostalgia. And that keeps the person away from everybody. Say, no, I don't want to mix with anybody. Can you think of some flower remedies in all these emotions? You can. So why can't we treat acne? Why can't we treat psoriasis? Why can't we treat eczema? Why can't we treat vitiligo? Why can't we treat lichen planus? Why can't we treat urticaria? I get really angry on my wife. She never makes good food for me. When I go back home, she gives me some stale food. And every time I go home, I get this urticaria. Are you getting it? What is the emotion here? That there is a lot of anger inside me. Why not holy to this person? So much itching, I cannot control. Why not cherry plum? I cannot bear the itching. Beach remedy. So giving holy beach cherry plum to this person can take care of his urticaria. Remember, we don't have to give always epis or urtica urens to these people. Our flower remedies come to our rescue. Remember, they are so simple. Epis may or may not help, because if you are not exactly giving the simillimum, it may not help. Dalkamara may not help, but our flower remedies will surely help. Remember, I am not saying that homeopathy will not, but homeopathy is difficult to individualize. Remember, it's not very easy. Many times you got patients of urticaria for years together and you can't do anything for them. Remember that. I had a patient for 3 years. I could not do anything. One of my worst failures. We always feel urticaria. Okay, we can give epis and urticaria urens and dalkamara and nux vomica. No, it doesn't work like that. But the moment other than looking at the red eruption, itching, aggravated warmth, better by cold, I also started looking at the mind of the person. Why is he getting urticaria? What is his anger? Where is his anger coming from? That is the psychodynamics of urticaria. That there is a lot of anger inside. Psychodynamics of hyperacidity. Too much anger. Too much undigested anger inside will lead to acidity. Remember, ask any and every patient of yours who has got acidity, who has got heartburn, who has got water brash, who has got pain in the chest due to acidity. There is a ungulped, there is a undigested anger inside, and you will surely find out the cause. Just ask the person, who are you angry on? Where are you not removing your anger? That will lead to hyperacidity, remember. So learn that, that is very, very important. Okay. So these are the general feelings when you get any problem, especially skin problem, of course. So the first remedy I'll think of when the person asks the person that when you saw this acne, what did you feel? Doctor, I was shocked. How could I get this problem? So the first remedy for shock is Star of Bethlehem. Remember, it's a general remedy for any and every shock. And what do these people want? They are like Econite. Remember, they want Jadoo ki Jhappi. You know Munna Bhai, right? Munna Bhai movie. Have you seen? In Munna Bhai, they say, "What is Jadoo ki Jhappi?" Huh? They give the mother gives the child one hug, and you feel better. So Star of Bethlehem is a jadoo ki jhappi for any and every person after shock. Remember, so after death, after bereavement, after grief, anything, the first remedy to be thought of. So even with the skin problem, seeing a acne on the face and getting shocked and saying, "How could it happen to me?" Star of Bethlehem is a comforting remedy to be taken in such conditions. Remember that. Next remedy is walnut. Now, walnut is all the remedies about transition. Remember, when you are going into puberty, lactation, pregnancy, marriage, changing of school, changing of office, menopause, these transitions at these transitional levels, if you get any problems, skin problems, also adjusting within people. How can I adjust with all the people? All the girls in my college, they're so beautiful, their skin is so beautiful, and I have to go with all these people. How can I adjust with them? When the person talks about adjustment, think of walnut. Walnut is the second most important remedy which will come in any and every skin problems. But these words have important. Kaise bolta hai, that is important. It is not about what he talks, it's about how he talks. When the girl says, when you ask the girl with pimples and ask her, how does this pimples affect you? She says, sir, I cannot go in the classroom because there are so many girls and their skin is so beautiful. My skin is so dirty. My skin is so ugly. I look so ugly. How can I go there? I'm just not able to sit there, and the problem is of adjustment. So they are not able to adjust. Think of walnut. Now, here, is walnut a remedy for pimples? No. Walnut is not. So, according to the philosophy, we are right. We are not giving it for physical problems. But look at the mental state during the physical problem and you can treat them. Remember? So, walnut people are, is a remedy to help us protect against outside influences and against the effect of change. Okay. So it is a transition and link breaker. They have an aversion to change. So puberty, acne and other skin problems. During pregnancy, if you get melasma, post-pregnancy obesity, walnut could be an important remedy. But remember, there has to be this feeling. There has to be this mental emotion. Just don't give it for melasma. Just like CPI you give for every woman coming with a butterfly, you think of CPI, CPI, CPI. No, it's not like that. Doesn't work like that. Homeopathy as well as batch flowers, they don't work like that. There has to be a central core feeling. Okay. Next, of course, the most important remedy which you have to have in your case, which you have to have in your box when you're treating skin problems is crab apple. What is crab apple? Crab apple is a cleansing remedy, साफ करने वाला, अंदर से साफ करने वाला, which cleans. It's like a jhadu wala. It cleans all the gandagi from our life. So even crab, the main feeling is that there is something wrong in me. There is something wrong in my blood. I am not good enough. Remember lac cananum, the homeopathic remedy. I am not good enough. So whenever this feeling comes up, crab apple is number one remedy. When the person would ask you, I have got pimples, I have got psoriasis, doctor, I think there is some problem in my blood. Do you think I need a blood test? Should I do a blood test? Think of crab apple. Okay. Its main use is to help people who dislike some aspect of their appearance or personality or feel that they have something unclear or poisonous about them. Most important thing is, imagine somebody coming to you with hair fall and her hair fall is too much. Okay, she says my hair fall is too much, but she's not concerned about her hair fall. She's concerned only about a small pimple on her face. This is the characteristic of crab apple, that they neglect the big problem they have, but they will look at the small. For imagine somebody having a cancer, but she comes to you not for cancer, but she'll say, I have got this stain on my cheeks, can you remove this? So this is crab apple again. So they disregard genuine problems and concentrate obsessively. The word obsession is very, very important. Somebody doing the same thing again and again. So obsessive compulsive neurosis, OCD disorders. Think of continuously washing face. I have got acne, I have got oily face, so I'm washing my face again and again to remove the oil. Think of again crab apple, because there is a obsession, remember. We might take crab apple to cleanse obsessive repetitive behavior such as hand washing, rechecking appliances which are unplugged and so on. This is a remedy for cleansing. This is what Dr. Batch says. For those who feel as if they have something not quite clean about themselves, often it is something apparently little important. In others, there may be a more serious disease which is mostly disregarded compared to one small thing which will they'll concentrate. So this person will come to you and you will see that they have many problems, but they will concentrate on the smallest problem. And you will say, Arey, you got this problem, you got arthritis, you got indigestion, but you are just concentrating on this small pimple on your face. Think of crab apple. Very, very important. Okay. There is a self dislike, something in the body or mind that they don't like. They want to get rid of it. Remember, the first thing crab apple patient comes to you says, Doctor, do something, get rid of this problem. I just want to get rid. Whether it is cough, cold, vomiting, stomach pain, menstrual problem, arthritis, when he says, Doctor, do something, I want to get rid of this problem. Put it in inverted commas, rid. I want to get rid. So there is a rubric in the repertory called kill desire to remember. There is a rubric called kill desire to. Even patients who are going to, we are going to use the rubric kill desire to, they will say, I want to get rid of this problem anyway. Hook or crook, I want to get rid of. I feel like cutting off this part. I have got psoriatic patch and there is so much itching, doctor, that I feel like cutting off the part. Just I want to get rid of this problem. That is crab apple, getting rid of the problem. We want to take it away from our body. Something on our body that we don't like, sense of inadequacy. Skin problems like acne, scars, and who want to get rid of the skin problems at any cost. They apply lots of creams and lotions. When they come to you, they'll bring a lot of skin lotions, creams. They have done so many treatments. They have gone from one doctor to another. So remember, crab apple is a must in your medicine case when you are dealing with skin problems. Remember them. I would go to the extent of saying 99% of your skin patients need crab apple in your combination. Remember that. Put crab apple, put walnut. These are few basic remedies that you will start with. Remember, just close your eyes, make crab apple and walnut ready, and then look at the feelings and start adding. Okay. Crab apple even with rescue. Some patients had I had a patient with non-healing ulcer. And again, he said, oh, I don't know what this ulcer is. I just want to get rid of it. So I gave crab apple and rescue. So there was a cream, calendula cream. I put crab apple and rescue in that and told him to apply the cream and the wound got healed. That is the power. Even locally, these medicines can act. Remember, crab apple in calendula, crab apple in echinacea, crab apple in thuja will work wonders for many problems. Remember. They can't even bear even a small spot on their face. In public places, they avoid going to public functions. They are embarrassed and cover the affected area. They are ready to go to any extent to get rid of the skin problem. They feel inferior to others and try to hide their problem. We have talked already, poor self-image, low self-esteem, embarrassed, ashamed, cleans internally. Remember, don't just give crab apple empirically. With this feeling has to be there that there's something dirty inside. There's a foreign body sensation or some poison inside me. So long. Hello. Yeah, this is Dr. Chaukkar. Ma'am, I am in a webinar. Is it possible that I can call you after half an hour, ma'am? I have your number. I'll call you in half an hour. Okay. Thank you. Bye bye. Somebody who wants to leave addiction. Now remember, many of people give crab apple just as empirical remedy to leave away addiction. No, the person should feel that I want to leave addiction. As such, remember all the addicts, whenever somebody is taking alcohol, drugs, cigarette, whatever addiction is there, they never agree that the problem is with them. They always feel the problem is with the wife, the problem is with my son, the problem is with my father. I don't have any problem. So they are basically in denial. All of them are in denial. So when the person starts recognizing, yes, there is a problem in me, I need treatment for this, I am ready to take treatment for this, then only crab apple will act. Remember. So don't give crab apple blindly for addiction. In many books, it is given crab apple for addiction. No, the feeling is that I want treatment. I want to get rid. Remember, I told you, I want to get rid of this addiction. I want to get rid of this problem. Then only crab apple is indicated. Okay. As I have told you, crab apple plus holy plus petroleum jelly. Very, very important remedy for cracked heels. Now we are going to have winter, so a lot of our patients will have cracked heels or psoriasis or palmoplantar psoriasis. Think of crab apple, holy, and petroleum jelly. Remember that. Also, for side effects of antibiotics and cancer remedy, think of crab apple and SOB, that is Star of Bethlehem. Okay. Only when the patient wants to leave the drugs, leave the alcohol, then only crab apple will work. Now remember, there is another remedy called cherry plum. Now cherry plum is for uncontrolled behavior. Anything which is uncontrolled, so therefore cherry plum also becomes an important remedy for addiction because it is uncontrolled. You cannot control your addiction. You keep on drinking even if you don't want to, even if you know there are negative consequences, still you are going to drink. So think of cherry plum. The patient will say that I want to leave addiction, but I don't know, I just cannot control. So you got two remedies clearly, crab apple and cherry plum. Mix them and give it to them. Walnut again, because he has to adjust to the surroundings. He just cannot adjust. Remember, he says that whenever I go past a beer bar, I feel like going in the bar. Or when I sit in the bar, there are people who are drinking and I also get an urge to drink. So again, walnut is a very, very important remedy for transition. So can you see how you can apply the batch flower remedies which are meant only for emotional problems in physical problems also? Okay. They are very, very fastidious, remember. This is our arsenic or nux vomica. They are our crab apples, remember. So even when you think constitutionally somebody is arsenic or nux vomica or carcinosin, you could think of giving crab apple as an adjuvant. Remember, for the fastidiousness or too much hating of germophobia, washing hands again and again. So all the three nosodes, medorinum, soranum, and carcinosin and syphilinum also, right? So cleanser remedy, feeling of contamination, they will cover and try to hide, fear of infections, to remove side effects of allopathy. Remember, allopathy or even cancer drugs, when they come to you with chemotherapy and radiotherapy, side effects, losing of hair, feeling that, oh, what has happened? I've become ugly now. I don't look good enough. There is some problem in my blood. Think of crab apple. So side effects of chemotherapy, side effects of radiotherapy, think of crab apple. To remove side effects of allopathy, when we give antibiotics to some children come to us for homeopathic treatment, diarrhea after antibiotics. Think of crab apple, remember, which is very common. Small children, even adults suffer from antibiotics, diarrhea. Remember that. Wants to get rid of something. When the addict wants to leave the addiction, then only crab apple will work. Okay. Next is cherry plum. The word for cherry plum is uncontrolled. Anything which is uncontrolled, somebody coming to you with eczema, urticaria, or any skin problem and saying, oh, doctor, you don't know, it is so much itching. I just cannot control myself and I just scratch off the part till it bleeds. First remedy, think of cherry plum because it is uncontrolled itching, remember. Cannot stop scratching till it bleeds. Now remember, this is not a symptom of cherry plum. Cherry plum is about uncontrolled emotions, fear of going mad, fear of uncontrolled emotions. I cannot control myself. But we are trying to apply this into physical problems where you cannot control. So, lack of control is cherry plum. It's not lack of control of itching is not cherry plum, but lack of control, we are taking this symptom in form of itching. Okay. Fear of losing control, doing something dreadful, such as injuring or harming oneself. One person with psoriasis had so much itching. He said that I feel like taking off the part with a knife, scratching off the part with a knife. I just cannot, my hand goes to the knife many times to scratch it off, but then I hold myself. This is cherry plum. Fear of going mad with impulses, remember that. So fear of going mad and acting irrationally are cherry plum states. So no control on mind, loss of control, cannot control his urge to scratch till it bleeds. Even after knowing it's not good for him, he will continue. This is the key of cherry plum. Like shopping addiction, kleptomaniacs, women of the best of the richest, they are rich millionaires, their husbands are millionaires, but they'll go to some parlor, they'll go to some big shop and they'll start taking small things here and there and putting, not that they cannot afford it, they can afford the whole shop, they can afford to buy the whole shop there, but they want to take that small thing and look here and there and not feeling caught. That gives them the kick, and that is the addiction, remember. Addiction is always giving you the kick, remember. So shopaholics, kleptomaniacs who go to shops, and this patient is going to tell you, straight away that, doctor, I cannot control. When I go to a shop, I feel like taking something and putting it in my pocket. When I go to the hotel, there are so many people who go to the hotel and they take the, the soaps from the bathroom. They'll take the polish from the bathroom. Many people can take even towels from the bathroom. Remember that. These are the people who will require cherry plum. Remember, they just cannot control. Not that they cannot afford. Remember, they have enough money. They can buy hundreds. They can even buy the hotel, but they cannot. I cannot bear. At the same time, there are physical states where there is lack of control. Can you understand what are the physical states where there is lack of control? Urinary tract infection. I cannot control my urine. I have to run to the toilet, otherwise my urine will pass. Lack of control. Again, wherever there is lack of control in Parkinsonism, there is no control over motion. See, this is what happens. My hands are moving. I cannot do anything. When I start holding, it starts moving like this. So lack of control, Parkinsonism. Diabetes. Somebody who just cannot resist sugar. Whenever I see a Kaju Katli, whenever I see a sweet, I just cannot, resist the urge. That is cherry plum. So for those diabetics who are gourmands, who want to eat all the time, who don't care about their blood sugar level, think of cherry plum. Anger uncontrolled leading to suicidal thoughts. So anything that has lack of control or loss of control, whether it is a mental problem or a physical problem, think of cherry plum. So you can very well think of cherry plum in Parkinsonism. You can think in urinary tract infection, nocturnal enuresis of children. Okay. Diabetes, of course. Alcohol addiction, shopping addiction, somewhere where you cannot. Uncontrolled pain. Now, this was one of the remedies that BACH has also said that when the soldiers used to come from the war, this was some of the remedies that he used to think of. That why not cherry plum? Cherry plum can be thought of because there is a lack of control. Uncontrolled pain was there. So look at cancers where there is a lot of uncontrolled pain. Think of cherry plum. Next remedy is pine. Pine is again, the key word is guilt. Maybe I have eaten something. Maybe I did not wash my hair properly. Maybe I went to this place. Maybe I went to a public toilet. That's why I got a fungal infection. This is very, very common in women, young women. They will not go to toilet, but maybe they'll go to some toilet and then they'll get some fungal infection or some kind of skin problem and they'll attribute it to that place there. Again, crab apple is very, very important, but there is also a feeling of guilt that I should not have gone to the toilet. What if I could have resisted my urge? I did not. I should have. So pine is again a guilty state. So whenever the patient talks of the guilt feeling, as far as using something or not using something, think of pine. Very, very important remedy. Scleranthus. When I am not able to make up my mind, many a times when we have skin problems, we'll say, oh, I've got a pimple, I've got acne. Should I have just apply a cream or should I go to a homeopath? Should I go to a homeopath or should I go to a dermatologist? Should I do this or should I do that? In fact, you don't do anything. Are you getting it? So whenever you have got confusion about two options, so when you ask the patient that how come you thought of coming to a homeopath? Say, no. For 2 months I was thinking, should I go to a homeopath or should I go to allopath? Ultimately, I came to you. This is how my personality is. I always think between two choices and I am always confused. Now remember, between two choices, this is scleranthus. Okay? Between two choices is scleranthus. Because we have got drugs like Serato, remember, where the problem is that they are very clear about the choice, but they keep asking people and they get confused. So you have to make a difference between scleranthus and Serato, remember that. Even wild oat. Now, wild oat is something related to a big decision in life. It is not about allopathy or homeopathy. It is about what should I do in my life? Should I do medical or should I go and sit in the Himalayas? These are the main choices. So when the person has many choices and there is a life-changing decision that he has to do, it is wild oat. But when it is a small thing every day, here or there, here or there, here or there, think of scleranthus. So that's why I told you scleranthus is a good remedy for motion sickness also. Because when you are sitting in the boat, when you are sitting in the car is moving like this, up and down, up and down, up and down. When you are going up the ghat, going downhill or going uphill, again, there is a problem. So scleranthus could be very well an important remedy for nausea or motion sickness. Remember that. Okay. Hornbeam. Now, hornbeam is yet another remedy. They keep postponing. They'll come to you after 3-4 months when the acne have become so big and you ask them what happened. Why didn't you come before? We could have done something with homeopathy or batch flowers. No, that is my problem. I can never decide. I always, not decide. I cannot, put it into action. Hornbeam is all about postponing or procrastination, postponing decisions. So I postponed it for 3-4 months and look what has happened. Now so much has increased. Okay. The person in this state feels wary when he looks forward to the demands of the day. I just don't want to go to the doctor. The homeopath is going to take whole history. Doctor, I don't want to do that. I'm just tired of that whole history thing. I don't want to give my history. So they are tired even before doing anything. That is hornbeam. There's another drug called olive, which is tired after doing the things. So tired before starting anything is hornbeam. Tired after doing something is olive. So there are so much subtle differences in batch flower remedies, remember. So we have to be very, very aware of that. Because if you give the wrong remedy, it is just like placebo. It is not going to act, remember. So selecting black flowers, there are 38 remedies, but it's not so easy, my friends. Remember, we always think batch flowers are very, very easy. They are not. Many times we can fail with batch flowers also, remember. Honeysuckle, जो past में रहते, those who are thinking of past. I had such beautiful skin, I had such beautiful hair. Doctor, you don't know. You should have seen my photographs 2 years back. I had such long hair, beautiful hair. Boys used to, fall for me so much. They used to like me, and now nobody even looks at me. Honeysuckle, nostalgic state of the past, thinking about past good things or bad things. Remember, it's just like our natramure and ignatia. Remember, honeysuckle is our Natramure is our Ignatia. Remember, we're thinking of the past. They recall the past without needing to relive it. Okay, so that is very, very important. It's honeysuckle. Clematis are the people who always think of future. They will not take any action. They are just Mungeri Lal. There was a serial long time. I don't know how many of us were born at that time. But this guy used to just sit not working and he would just go into dreams and do his eyes like this. And he used to go in the future that he's become a prince, he's become a millionaire. So he will just sit there and think of fantasies. So air castles, this is our sulfur. Remember, clematis is like sulfur, who are always building air castles but not doing anything. So even skin problem, they'll say, okay, tomorrow I'll go to the doctor, day after tomorrow I'll go to the doctor. They're postponing just like hornbeam, but at the same time also thinking that something good will happen at one time. Okay. Holy, anger remedy, jealous remedy, remember that. Okay, very, very important for negative, aggressive feelings. How she can be so beautiful. I'm so jealous of her. So whenever I'm thinking of lachesis, I'll also think of Holi, remember, because there's a lot of jealousy, suspicion in Holi, which is very common. When somebody has skin problem, they'll either try to hide it or they'll try to become very, very aggressive and jealous and envious of others. So Holi is a very, very, even for very, very big acne, red acne, violently itching acne, violent problems, reddish angry looking ulcers, think of Holi. Anything related to angry looking ulcers, angry looking acne, reddish acne, just like belladonna, hip herself, very, very sensitive to touch. Think of Holi, remember. That's how you can apply. This is inductive and deductive logic. Remember, we did in our first BHMS and second BHMS, we did Hanneman's inductive logic and deductive logic. So, application of generalization, remember. So, you can use like this also, remember. Willow, again resentment and bitterness of how others are good. So many a times holy and willow can be given together. Remember, they're very, very important remedies. Self-pity, why me only? Why I always get the problem? Why the other sister did not get pimples? Why only my skin is oily? Why I am getting acne? Why my hair falls? Why I've got this skin problem? Nobody at my home has skin problem. So this self-pity, resentment, keeping things in mind, grudge, a lot of bitterness, remember. Below. White chestnut, again, something which is recurrent. Now, white chestnut, remember what we had talked last time, white chestnut is for recurrent thoughts. So, people who are, cannot sleep because of too many thoughts inside, you can apply the recurrence word, just like uncontrolled word was for cherry plum. Recurrence word of white chestnut can be applied to recurrent infections, recurrent acne, recurrent skin problems, recurrent colds, recurrent acidity. Wherever the word recurrent and wherever chronic is there, think of the remedy white chestnut. Very, very, very important. Okay. This is how you can apply the mental qualities to the physical qualities. Remember, that's how, otherwise, you cannot say that batch flowers are good for skin problems. Yes, batch flowers are good for skin problems only if you consider the mind and the emotions. Remember. So, whenever the person complains of recurrent problems, recurrent skin problems, recurrent acne, recurrent hair fall, recurrent infections, recurrent tonsillitis, recurrent colds, recurrent acidity. Even after treatment, it comes back again. Think of white chestnut. Okay. Large, people who are less confident. Remember, once you start developing something on your face, something on your hand, you don't feel like going out, you don't feel like talking to people, you don't have the confidence to even go to the doctor. Imagine not talking to friends. So large is a very, very important. When the first thing the person would say that what is affected, because why are you, what is affected in you because of these pimples? I have lost my confidence. I just can't go out now. I cannot talk to people. I feel ashamed. I feel shame to talk to them. I'm shy. Think of mimulus, think of large. Remember, whenever we talk of fear and shame and shyness, think of mimulus. When you think of lack of self-confidence, think of large. Remember, okay? So very, very important remedy. Next is gentian. Developing of acne, developing of hair fall, developing of some skin problem, and you become depressed, you become despondent. It is the first level of depression. The person would say, no, now I'm not going to do anything. Now I'm not going to go out only. I will just sit at home. You got only one pimple and you're not going out? What does that mean? One pimple and I don't want to go for the competition. There was a beauty contest and she was all set up. She was all, makeup and everything. She just put some external makeup and she got some acne. And next day she becomes so depressed that she will not go to the competition only. So a little setback and you are completely kind of depressed. Think of gentian. So a lot of girls might require this who become very, very sad at the appearance of the pimples, at the appearance of the hair fall, at the appearance of a small white spot here or there. But if they are supported, if they are encouraged, if they are motivated by their parents, by their friends, they are ready to go out. Remember that. This is very, very important. So this is the beginning stage of depression. You can think of gentian, not like gores. Gores are completely depressed. They don't want to do anything. Remember that. Mustard also, they are completely depressed. They don't want to do anything. But gentian, as soon as you push them, remember there is a drug in homeopathy called strontium carb. Remember strontium carb, which is a remedy which requires a guru. They are very, very good, but they don't have the courage until unless they are being pushed by a guru. They require a guru to push them. Once the guru pushes them, they can go ahead in life. That is strontium carb. So this is gentian. Gentian is also like that. Remember. Okay. Gorse. Gorse is a remedy where people have given up complete belief and hope, hopeless totally. Nobody can help me. I have got so many acne on my face. I have gone to so many doctors. Nothing is going to help me. Go to this homeopath. This homeopath is good. No, 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 no. I don't want to go anywhere. I have just totally lost my hope. I don't want any treatment. Think of Gorse. Very, very important. There's another remedy called sweet chestnut. Of course, that is also just like gorse, who give up. So whenever people are depressed because of some problem, you can also think of a combination of gorse, sweet chestnut, and even, wild rose or something like that. We might do depression at some other time. We'll talk about depression and we'll talk of these remedies. Chestnut bud, very, very important. Failure to learn from past mistakes. Now, these people, they had taken homeopathy, they were better with homeopathy, then they got pimples, they never went to the homeopath again. They started applying some local ointments. They did not learn from their mistakes. You have to apply the qualities of the batch flower in the physicalities, remember. So this is this is for people who fail to learn from the lessons of the life. Okay. Oak is another remedy for perseverance. Now, these are the patients who come to us and stay with us. Okay, I have got acne. Doctor, you do something. I'm sure you can do something for it. I'm ready to take treatment for years together, but make my face clear. Are you getting it? Have you ever seen patients like this? Remember, yes, Dr. Ajini, do you know? So this is what I'm saying. What is, yeah, please say.
Yes, yes.
So every time when we are talking of a person or when we are talking of a remedy, it should, come in our mind. Oh, I saw a patient like that. Oh, I saw a patient like that. Because then only you'll be able to apply it in your practice. Because I think just writing will not help, isn't it? What is important is we have to understand that, okay, this is the kind of patient that I had seen once. So somebody who sticks to me for years together, imagine. Can you understand a patient who's got hair fall and sticks to you for 3 years, 4 years and saying, Doctor, no, I'm sure that you will do it. I believe you. I trust you. That is a perseverance of oak. Remember, oak will continuously persevere with you. Okay. So batch flowers now are selected on basis of emotions and feelings that a person goes through when he suffers from some ailment. Batch flowers are not selected for any disease name, but the emotion underlying the disease state, like lack of confidence, fear, anger, resentment, guilt, feeling that he is not clean enough, etc. etc. Okay. So that is all about batch flowers in skin. I hope you have understood this. You'll be able to apply it in your practice. It's very, very important. Now remember, they are not easy as is it said, as it is felt. Even I used to feel and I still feel that they are very easy. But the best thing is that when I fail, then I know I fall on my face and I know that nothing is easy in life. You have to really understand the deepest emotion of a person in order to. Sometimes I feel homeopathy is easier than bachelors. Remember, because homeopathy, you also have physicals to help you. You've got cravings, aversions, thirst, sleep, discharges. You have got this thing to help you to collaborate your, corroborate your prescription. But in batch flowers, it's not like that. Batch flowers is completely on emotions and feelings. Another thing, what we learned during the learning of batch flowers was don't go into the story of the person. There are many ladies, there are many males who will come and talk about their story. I did that, this, that, and go on story, story, story. Don't look at, tell him what was the exact feeling during the story is important. Are you getting it? So find out the exact feeling, find out the exact emotion, and give the batch flower. Don't give too many batch flowers together. Last time we said that at least 6 medicine can be given, but lesser the better. Remember, this is very, very important. That doesn't mean you give only one. There is always 2 or 3 or 4 medicines, 4 emotions together. So at least 4 or 5 medicines will be mixed. But don't go into 6 and 7. When you go to 7 and 8, you are diluting the whole thing. Remember that. If you have 8 remedies coming up or 7 remedies coming up, give 3 in one bottle, 4 in another bottle, like that. But don't mix all together. Look at the state of the patient. That's very, very important. When somebody comes to you with acne, somebody comes to you with hair fall, somebody comes to you with psoriasis, see how he is talking. How, not what. Everybody is going to talk about the same thing, that psoriasis is there, flaking is there, scaling is there, itching is there. How do you feel with that? What is he going to do? Whether he's going to hide it in front of you, whether he's going to become naked in front of you. Because when he shows it openly in front of everybody, that means he's becoming naked, remember. Are you getting it? Naked is not always removing his shirt and pant. Even showing the part which is affected very freely in front of others is becoming naked. So you have to use these rubrics carefully, use batch flowers remedy carefully, and use a homeopathy and a batch flower together. It will really give you success. Even when you're not confident of homeopathy, please give only batch flower remedies. Many a times you will be surprised that a patient starts feeling well only with batch flower. And you may not have to give your homeopathic remedy at all. Yes, but remember, my experience is that when there is homeopathy along with batch flowers, the remedy acts like a bullet, remember. That is what I have seen. It works very, very fast. That is my experience. I want all of you to understand and experience. I'm sure all of you are experienced practitioners, so you must have seen in your practice. So I think that finishes our section on skin. Probably at some other time we can do some batch flowers and some other problems also. So that's the
Thank you,
thing.
doctor. Thank you. It
Thank you.
was wonderful
Thank you very much.
session. You are looking, you are treating the batch flower remedy in different angle. In spite of treating the emotional, emotional cases. You are with that symptoms. You are treating the skin diseases. That is wonderful, and it is a awareness for us also. And one question I have: we can mix all this medicine, right?
Yes, up to 5, up to 6 you can mix because there are different emotions. Somebody has anger, resentment,
Yeah,
fear.
yeah. Even I was thinking, no, normally the patient who were depressed, no, they will be living in the past and
Yeah.
they will have uncontrollable
Exactly. Exactly. So you
complaining
can give
like that.
up to six medicines you can mix, not beyond 6, because after 6, it's better to give in 2 different bottles, remember. And the most important is you have to give it very, very frequently. So normally the dose is 4 drops 5 times in a day. So we cannot tell them take 2 times or 3 times, tell them 5 times in a day. 4 drops 4 times or 5 times in a day. Okay, of the mixture of the bottle, remember.
Okay. As you said, through the experience, it has to come because
Yeah.
uh, nothing is easy because
But you
while
should
we are
start. You should start. I
yeah
think that's
while
what
we are
everybody
seeing
should.
the cookery show even
Yeah,
in the
yeah.
YouTube. while seeing, oh, this easy, oh, how fast they are making. While while we are preparing something, then only we will understand
Yes.
what difficulties
I mean,
behind that.
even if they have to make a cookery show, they have practiced it many, many times. That's how they have made a show.
Yeah,
It's not the
exactly,
first
exactly.
time they are doing it, isn't it? When they make a show
Yeah.
on the YouTube, they have practiced it many, many times, isn't it?
Yeah, they are practicing many, many times. But while we are watching, no, as you said, we have a feeling that, oh, how fast they are making this. We can make. But
True.
even
No, not
when we are
possible.
keeping a pot in the stove
Yeah.
itself makes us
Yeah. Yeah.
tired. Okay, anyway, Dr. Hariharan has raised a hand. Dr. Hariharan, you can ask your question, please.
No, no. Hello, hello.
Hello. Yes,
Yes, sir,
sir.
you are audible.
Okay, okay. And, see, I have no doubt, but I like to ask one suggestion regarding RR, rescue remedy.
Mhm.
I like to ask this. You please explain about that.
The rescue remedy, sir, as the name suggests, it is an emergency remedy. So if the patient comes to you with some emergency, now imagine you have given some constitutional remedy or some remedy and there is a tremendous aggravation. And the patient comes to you, imagine the vitiligo has started spreading, the psoriasis has increased, the acne have increased after your so-called stimulum remedy. And he is in a state of emergency, fear, fight, flight response. And he's really very, very angry also. He doesn't know what to do. There are many remedies. Now remember, rescue is a combination of many remedies. Rescue has cherry plum also. So lack of control is also. There are 5 remedies in rescue, remember. So all these 5 remedies, when rescue remedy you give, it will really cool down the person. It will give him good sleep. It will calm down the person. It will even calm down the allergic reaction or the aggravation of the patient. So for any kind of homeopathic aggravation, look for rescue remedy. Always rescue remedy, as the name suggests, rescues you, rescues the person, rescues the problem of the person. Remember. Okay.
Okay, good, good, good.
Thank
See,
you, Dr. Hariharan. And Dr.
see,
Okay,
see,
okay, you proceed.
see. We in Kerala, doctors usually practicing see back flower remedy.
Ah.
Sir, Dr. Gopi Krishnan from Palakkad. He is very intelligent, and he is using these back flower remedies. See, a lot of years. He has the experience for that, and he is regularly taking the class for this back flower remedies in our platform in
Very good.
Malayalam. In
Yeah.
Malayalam.
Yeah.
So from him, we studied how to practice this back flower remedy, and a lot of doctors are now practicing in Kerala the back flower remedies and getting result also. Usually, I am also using back flower remedies in almost most of the cases, and I am also getting a lot of result. So very good, doctor. See, you came this English platform and done a very good job. Okay, thank you very much.
I will also surely like to come on the Malayalam platform, but I'll have to learn Malayalam first. Then I will come. I would
No
love to
problem.
come on the Malayalam. Dr.
No problem. We
Ajini
have
will teach
Malayalam.
me Malayalam.
Okay, after
No,
studying Malayalam. So
Yes.
yeah,
see,
we
I,
have
they
I
translation available in IFPH because
yes.
normally the Russian doctors, Mexicans, and when they are taking the classes, one Mariam Salcedo is there. She
Wow.
will translate. Likewise, if you want, I will translate.
One of,
No
one of
problem.
one of my friends, she's there from Turkey here. What's her name? I just saw her name.
Selvi,
Sevgi is
yeah,
there. Yeah,
yeah,
she's always there. Yeah,
she
she's
was
always there.
listening. Yeah, she
Yeah, yeah.
was
Last
listening.
time
Yeah.
also she was
And
there.
one more thing I wanted to ask you, doctor. Sometimes we are getting it as a potentized form, but it will act or not.
What potency? It is the first potency. Usually they are sold as 30 potency only.
Yeah, while asking the remedy in the medical store, after buying only, we are noticing before we don't know that it
No,
it is in the mother tincture form
no,
itself. But
they are not actually potentized. They are flower extracts because if it was potentized, then they
yeah,
could be
but
homeopathic,
we are
isn't it?
getting. I have that medicines here
Yeah,
in potentized. I mean,
they label it
will they
as
act?
30. They label
Yeah,
it as holy 30, clematis 30, but they are not
yeah.
potent. They are flower extracts, either water extracts or alcohol extracts. They are not potentized.
Uh, so that will they act?
Yeah, of course they lacked. Why not? But
So how
they are not proved. They are not proved, remember. First thing is they have to write potency. According to the pharmacopoeia, whatever medicines related to homeopathy are there or flower extracts are there, we have to write the potency. So 30 potency is just written like that. Yes, nowadays people are potentizing, but then now there is a company which I don't want to name, they also potentize, they are giving 30 and 200 also. But that's not how Dr. Batch made it. Batch were directly giving it only on emotions. They are not proved anywhere. They are from the collection of Dr. Batch. So we have to give it the way they are, not change it in any way. That's how the philosophy of Batch is. Okay.
So this is useless, right? We
No, no,
can't
they are
use.
not. No, no, they are not useless. You can give, but the thing is,
How
they have to write the potency. That's what I'm saying. Legally, you have to write the potency on that. Whether potentize or not, they have to write 30 on it to sell it in the market. Are you getting it? You cannot have
Okay.
just
If
holy.
I'm getting 30 potency means how I have to give to the patient, like
You can,
one drop, two
no,
drop,
no,
how
you can give it in your pills. No, we give it in our pills. No, this is how. See, these are the
like
pills.
like one drop, huh?
I
Like
have. Uh,
yeah.
these are pills, 35 number pills. You can put 3, 3,
Ah,
4, 4 drops of each medicine, shake it, and then
ah.
give it to the patient. 4 pills, 4 times or 5 times in a day. That's how we give. You can give
So
it in
that
water
will
also. You can give it directly also. You can put direct drops on the tongue also, or you can give in pills. Best for homeopaths is pills. You can just give pills and mix them.
okay, doctor. Okay, thank you so much.
Okay.
And
Somebody asked
anyone
you.
else have questions?
Somebody said, sir, any book for it? There are many, many books for it. Chancellor is a good book, remember. And I think there is one doctor in the South, Ramakrishna or something. I think there's a very nice book written by him. So there are many books.
Yeah, Dr. Selvi.
Yeah.
The,
I'll
one of the fine book is that Farooq Master repertory.
Yeah. Farooq
Yes.
Master is still a recent book. There are many old books also, and there are many other good books. Dr. Master's book is also good, but it is more of recent book. I think you have to go into also the basics of philosophy. So Dr. Chancellor is a very, very good book. I usually read from that book. Hmm?
Dr. Sevki, you can talk now, please.
Um, Good evening. Thank you. It is very excellent session.
Ah,
And I'm happy to see again here IFPH session. And I must learn and I want to read about a lot of things. Then later I'm ask some question. But now I want to ask if you maybe you in other session maybe you explain your case and using Bach flowers and homeopathy with together. I don't know. I don't know about some things. Maybe next session you will explain that. And I want to your method, using method. For
sure.
example, if you patients come you and will come and you give batch flowers or at the same time homeopathic remedy, I want to learn that. Thank you so much.
Thank
And
you.
Dr. Sevgi, you can say a lot of thanks to your mentor on behalf of IFPH, and we'll move to the Malayalam session. Oh, you have unmuted. Please unmute again, Dr. Sevgi.
Yes.
You can say a lot of thanks to
Thank you.
Dr. Samir.
Somebody is asking, can you use batch flowers? Farida is asking, batch flower in place of PLs. No, now batch flower is not a placebo, remember. Batch flower will help in always accentuating the cure. So it cannot be used as placebo. It's not, but instead of placebo, yes, because what I used to do in my practice for a long time, now it's 32 years since I'm practicing. Initially, when I started my practice, I am a single remedy homeopath. So giving one remedy and placebo. But now what I have changed is instead of giving placebo, I give a batch flower along with the constitutional remedy. And I think the results are much, much better. What I compare of the
Yeah, maybe
first 15 years
that
of
is
my
the
life,
question
and
of Dr. Farida.
yeah.
And Dr. Ram Parvez,
Oh, thank you, Anjani, and congratulations, Dr. Samir Chaukkar, sir. Very nice presentation. Excellent. And describe the best flower remedy. Very good describe. Best flower remedy. Any flower remedy is a prevention of all diseases.
Yes.
Any flower. The best flower remedy is a very good. मेरे हैंड में बैच फ्लावर रेमेडी है। हम
अरे वाह,
रेस्क्यू
very
रेमेडी,
good.
हाँ, रेस्क्यू रेमेडी and cherry, it is a very good 12th batch flower remedy is the very good preparation of Edward Batch. So very thanks Dr. Samir Chaukkar ji.
Sir, I
Thank you.
suppose
Thank
I
you.
suppose you are
Thank you.
from Bihar, right? Bihar से हैं आप?
Bihar at a Supal district, Bihar.
Because I see that.
Thank you, Dr. Ram Parvesh.
Yeah, Ram Pravesh सर, आपके यहाँ पे ठंडी बहुत है. आपने यो पुट मफलर,
हाँ,
तभी मुझे पता चला आप बिहार से हो.
Mithilanchal at a place Mithilanchal.
Good.
Okay,
Thank you.
sir. Now it is the time for the Malayalam session, local
Thank you.
language. Now we are moving to Malayalam session. I am inviting Dr. P. Shaila for Malayalam to moderate Malayalam session. Dr. Samir Chaukkar, it was a wonderful presentation. Come again and teach us. Thank you so much.
Bye.
Thank you.
Bye.
Very
See you tomorrow at the same time. Thank you. Dr. Shaila, you are welcome.